How do avian vets diagnose bird diseases? Have you ever wondered how veterinarians who specialize in avian medicine figure out what is wrong with our feathered friends? Diagnosing bird diseases is a detailed process that requires a keen understanding of birds' unique needs. Let's break it down step by step. First, the veterinarian starts by gathering a thorough history. This involves asking questions about the bird's symptoms, environment, diet, and behavior. Any recent changes in the bird's routine can provide important clues. The physical examination follows, where the veterinarian checks the bird's body condition, feather quality, and listens to respiratory sounds. They also look for visible signs of illness, such as swelling or discharge. Next, sample collection is a key part of the diagnosis. Since birds often show vague symptoms, laboratory tests are essential. Common samples include blood, feces, cloacal swabs, and sometimes tissue biopsies. Blood tests are particularly important. They help evaluate organ function, detect infections, and identify blood parasites. A blood smear may also be examined under a microscope for further details. Fecal analysis is another critical step. By examining droppings, veterinarians can identify parasites, bacterial infections, or fungal elements. For instance, egg counts in feces can help diagnose parasitic infestations, especially in birds of prey or poultry. Microbiological tests come into play as well. Cultures and staining techniques help identify bacterial, fungal, or parasitic agents. Rapid tests can detect certain pathogens, making the process quicker. Polymerase chain reaction tests are also used to find genetic material of pathogens like avian bornavirus or chlamydia. These tests are sensitive and can catch infections early. Imaging techniques, such as radiographs or X-rays, provide critical information about the bird's internal structures. These images help detect masses, foreign bodies, or organ enlargement. Because birds are delicate, sedation or gas anesthesia is often necessary to get clear images. In some cases, advanced diagnostic procedures may be required. For example, veterinarians might use endoscopy to visually inspect internal organs or collect biopsy samples. Histopathology, which involves examining tissues under a microscope, can confirm diseases like proventricular dilatation disease. However, biopsies can be risky and are not always performed. Once all the tests are completed, the veterinarian interprets the results. This often requires combining test findings with clinical signs and the bird's history. Some diseases may need repeated testing over time to confirm infection status, especially when results are unclear. Regular wellness exams are also recommended to catch problems early. In summary, avian veterinarians use a systematic approach that includes clinical assessment, sample collection, laboratory testing, imaging, and sometimes tissue biopsies to diagnose bird diseases accurately. This thorough process helps tailor treatment plans specific to each bird's condition. If you are looking for a veterinarian specializing in avian medicine, ensure they have experience with birds and can provide the necessary diagnostic services.